Are we ready for presenter number 3? Yes, we are. It's Maria Valero, and she's presenting Changing Lives with Technology from the College of Computing and Software Engineering.
Good evening, everyone. I'm Maria Valero, and today I'm happy to drive you to some of the exciting research we are doing in the College of Computing and Software Engineering at KSU, how we are changing lives using technology, specifically how we are using interconnected devices to improve healthcare in our communities. Nowadays, we have devices everywhere. You probably have an Amazon Alexa at home or a smartwatch, or even if you have more money, you have an intelligent car. So thinking in ways to leverage this information to improve healthcare is not easy, it's not difficult to imagine. So today, I'm going to show you how we are using devices and sensor networks to improve personal healthcare, community healthcare, and senior healthcare. And I'm going to show you 5 of the projects that I am working on that we believe that is going to change the course of healthcare thanks to technology. So talking about personal healthcare, I don't need to tell you the amount of people living with diabetes nowadays. It's huge. And you probably know that they need to pinch the fingers multiple times per day in order to get the blood sugar. And this is very painful, but how if I tell you that we can solve this discomfort? So currently we are using small and inexpensive devices like a small computer, a small camera, and a small laser to non-invasively monitoring people using pictures of the fingers and other extremities to estimate the blood sugar in real time. And what is our final goal is to create the first and novel earring that can calculate your blood sugar without even, have to pinch yourself. And this is just sending information to your smartphone in real time. So this is a life-changing technology for people with diabetes. And what about the current pandemic? Everybody knows that people with, COVID-19 needs to quarantine at home, and thankfully they don't need to be hospitalized. But how we know if they're actually doing well? How we can help them to monitor themselves and know if they're doing well, if they're progressing or not. So nowadays, people are using this device. This is an oximeter. And basically what it does is measure the level of oxygen in your blood. And this is very convenient, but sometimes people don't know how to use it, and sometimes it's confusing to read the results. So we're thinking, okay, how about if we can find another way to measure respiration and how other ways to utilize our technology to do this purpose. And we realized that everybody has Wi-Fi at home. So Wi-Fi is everywhere. We have Wi-Fi signals everywhere. So how about taking advantage of the Wi-Fi signal? Well, we did it. We create a prototype that can non-invasively monitor respiration and even shortness of breath, taking the information of the Wi-Fi signal. We can measure the movement of the chest, and we can measure the respiration thanks to that. And you don't need to even use anything. And then now we are talking about senior healthcare. So if this pandemic show us something, is the love and the care of our senior people. And we were thinking about ways that we can monitoring them in a, not too invasive, and we don't want to put them in cameras. People need to be monitored. They fall down multiple times, even if they live in a senior facility, they need something that help them to monitor and solve the problems that they have. So we were thinking, okay, how we can use that to monitoring even not only fall downs, also small and simple things like they are taking enough showers, they are washing their hands, they are brushing their teeth. We don't know that, and we cannot put a camera in the bathroom, right? It's very invasive and we cannot do that. So we say, okay, maybe we can solve this and we can monitor them. And we just create a prototype that is a small device that you can placed in your bathroom, and it's based on a vibration sensor. And what we do is sense the flow of the water. So basically, with the flow of the water, we can determine if the person is washing hands, if the person is taking showers or flushing toilets for monitoring. Now, public healthcare. I think everybody here has been in an ER, and this is very crazy. The crowding of the ERs is too much. So even people has died waiting in the emergency room. So this is a huge problem. How we can use devices to solve this? Well, we use these devices that you see here, and we create a mathematical model that allow people arrive to the ER. We can put this device on, and we can create the priority list for nurses in real time. That means that if the person deteriorates, the nurse can know immediately. And what about the way that we learn? So yeah, health and learning is also related. So we were pretty much interested in knowing how affect the way that we feel things, the way that we learn. So we say, okay, maybe we can use devices also to, learn how we learn. So we use this device that is a neuro headset that basically what it does is read the brain signals. And what we want to be interested on how these brain signals affect, if we can learn how we can learn using the emotion of the person. And what we did was a very cool project in which we read the level of emotion and we estimate the level of interest, focus, and engagement of people while learning some cybersecurity content. And we were able to determine which part of the content is more attractive to people. And this is going to be a very life-changing thing for our college or community. So in our college, I'm very proud of the research that we are doing right now, and we thank the administrations for all the support, and we really think that we can continue making an impact and changes life with technology. Thank you.
Thank you, Maria. That was wonderful.